Kidney is an important organ in the human anatomy which performs the function of excretion and purification. How important is this to the body?
Most important of all is to remove waste products from the body. They also remove drugs from the body. They also help in maintaining the water level in the body, and they secrete and metabolize and vitamin D.
Diseases affecting the kidney has been categorized into two, acute and chronic. What are the differences?
Acute being rapid onset, lasting less than 3 months, and usually the person then recovers kidney function almost completely. Chronic, on the other hand, is more subtle in onset, tends to be progressive and irreversible, and generally it's on for more than 3 months, and that's how we differentiate between the two.
There is now a growing consciousness of educating people on ways of preventing this life-threatening disease.
One of the core focus of the criterion is reproductive health. So we used to have that as our focus. Now we realize that even if you go on the internet, I went on the internet and I realized that renal diseases is presently one of the major killer diseases, to an extent that from a study carried out by 2 researchers at the University of Nigeria, Enugu, it was discovered that at least 8 to 10% of admission cases in the hospital is out of renal diseases. And then because of the scary nature of the statistics as it is available, we decided to bring ourselves together and the public and educate people about this particular scourge, with the thinking that inshallah it will be reduced from what people would have learned from the lecture.
Could this be as a result of its prevalence in the society?
We don't have exact figures because we don't have many community-based studies. However, some people have looked at kidney disease in their communities, so say in part of the north, a part of the south, and the figures are between 10 and 20%. So that means between 1 and 2 of every 10 adults has chronic kidney disease.
People around me, in fact, we have some of our members as well who have had problems who have come in contact with this particular disease, and they have been trying as much as possible to manage it. But because of our passion for ourselves and the people, women and children in particular, we feel that we cannot leave these people to this problem, and we cannot continue to have more of it. It is better we reduce it, because it's always said that prevention is better than cure.
The most dangerous aspect of kidney disease is that it may not show any sign in its early stage. What then can one watch out for, and what test is recommended?
Most times, to test for kidney functions, the doctor will request for urinalysis and electrolyte and urea tests to see how the kidneys are functioning.
Providers are always saying prevention is better than cure. There's no better disease to describe that saying than kidney disease. At least once a year you get a routine medical checkup. It's so important such that there's a problem, it can be detected, and something can be done about it. A lot of people who have kidney disease have had hypertension for many years without knowing. They even have the kidney disease for many years without
urinating more frequently than before, or feeling a different color in the urine can be a sign of a kidney problem. If it's darker or if it's light, if there is blood in the urine, if there's pus in the urine, if there is pain on urination, that could also help in showing that there is a problem somewhere along the urinary tract.
The key word is to take regular medical checkup as important, and always visit your doctor when the need arises.
Let us all use water. That's the first one that an advisor has been giving. You take at least about 5 liters of water every day. We have been advised to manage our drugs regularly. Follow the